General advice for knee pain relief. It's important to note that if you are experiencing persistent or severe pain, it's best to consult with a healthcare professional for an accurate diagnosis and personalized recommendations. In the meantime, here are a few suggestions. 1. Low-impact exercises. Engage in exercises that are gentle on the knees, such as swimming, cycling, or walking. These activities can help strengthen the surrounding muscles without putting excessive stress on the knee joints. 2. Stretching and flexibility exercises. Perform stretches that target the muscles around your knees to improve flexibility and alleviate stiffness. Always warm up before stretching and avoid bouncing or jerking movements. 3. Strengthening exercises. Strengthening the muscles in your legs can provide better support for your knees. Try exercises like leg lifts, squats, and lunges. Start with light weights or just your body weight and gradually increase over time. 4. Rest and elevation. When experiencing knee pain, it's crucial to allow your knees to rest. Elevating your legs with a pillow or cushion can help reduce swelling and alleviate discomfort. Regarding your diet, certain foods have anti-inflammatory properties that may help with pain relief. Consider incorporating foods rich in omega-3 fatty acids, e.g. fish, flax seeds, turmeric, ginger, and leafy greens into your meals. Remember, it's important to consult with a healthcare professional for proper diagnosis and advice tailored to your specific situation. There are several stretches that can help with knee pain. Here are a few examples. 1. Quadriceps stretch. Stand near a wall or find something to hold onto for balance. Reach back and grab your ankle or foot, bringing your heel toward your buttocks. Hold this position for about 30 seconds on each leg. 2. Hamstring stretch. Sit on the edge of a chair and extend one leg straight out in front of you. Lean forward from your hips until you feel a gentle stretch in the back of your thigh. Hold this stretch for about 30 seconds on each leg. 3. Calf stretch. Stand facing a wall or counter and place your hands against it at chest level. Step one foot back and keep it straight, pressing the back of your heel into the floor. Lean forward slightly, bending your front knee until you feel a stretch in your calf. Hold for about 30 seconds on each leg. 4. It band stretch. Stand with one leg crossed behind the other and your feet shoulder-width apart. Lean towards the opposite side of the back leg until you feel a stretch on the outer side of the leg. Hold for about 30 seconds on each side. Remember to breathe deeply and never force a stretch to the point of pain. If you experience any discomfort or your symptoms worsen, it's a good idea to consult with a healthcare professional. Aside from stretches, there are various exercises that can help alleviate knee pain. Here are a few examples. 1. Straight leg raises. Sit on a chair with your back straight and extend one leg out in front of you. Lift your leg up until it is parallel to the ground, then slowly lower it back down. Repeat this exercise for 10-15 repetitions on each leg. 2. Wall squats. Stand with your back against a wall and your feet about shoulder width apart. Slowly slide your back down the wall into a squat position, ensuring your knees stay aligned with your toes. Hold this position for 5-10 seconds, then slowly slide back up. Repeat this exercise for 10-15 repetitions. 3. Step-ups. Find a step or sturdy platform and place one foot on it. Push through your heel and lift your body up onto the step, then lower yourself back down. Repeat this exercise for 10-15 repetitions on each leg. 4. Mini squats. Stand with your feet shoulder width apart and slowly squat down until your knees are bent at a 45-degree angle. Hold this position for a few seconds, then slowly rise back up. Repeat this exercise for 10-15 repetitions. Remember to start with low intensity and gradually increase as your pain allows. It's always a good idea to consult with a healthcare professional or a physical therapist before starting any new exercise program, especially if you have persistent knee pain.